Imagine this. You wake up one morning, take your usual handful of pills, the same ones you've been swallowing for years, and you feel fine. Maybe a little stiff, maybe a little tired, but fine. Now imagine learning that one of those pills, something your doctor prescribed years ago for a simple ache or a minor complaint, has been quietly thickening your blood, stiffening your arteries, or pushing your blood pressure into dangerous territory while you slept. This isn't a scare tactic. This is published medical research, and today we're going to walk through 5 extremely common medications that millions of seniors take every single day without realizing the cardiovascular risk sitting in their medicine cabinet. Now, before we go any further, let me be absolutely clear about something. This video is not telling you to flush your medications down the toilet. Please do not stop any prescription without talking to your doctor first. What this video will do is arm you with knowledge, the kind of knowledge that lets you walk into your next appointment and ask smarter questions, request alternatives, or simply understand what's happening inside your body after age 60. Here's why this matters right now. After 60, your liver processes drugs more slowly, your kidneys clear waste less efficiently, your blood vessels lose elasticity. That means a medication dosed for a 40-year-old body can behave very differently in yours. Side effects that were minor at 50 can become genuinely dangerous at 65 or 70, and cardiovascular events, heart attacks, strokes, blood clots, remain the #1 killer of older adults in the United States. So let's get into this. 5 pills, 5 risks, and what you can do about each one. Number 1. Non-steroidal anti-inflammatory drugs. You know them as ibuprofen, that's Advil or Motrin, and naproxen, which is Aleve. These are arguably the most common over-the-counter painkillers in America. Arthritis flares up, you grab the bottle. Your knee swells after gardening, you pop 2 tablets. Back pain from sleeping wrong, another dose. It feels harmless because you've been doing it for decades and nobody ever told you to worry. But here's what the research says. A large-scale Danish study published in the European Heart Journal followed over 10 million adults and found that ibuprofen use was associated with a 31% increased risk of cardiac arrest. Naproxen carried its own elevated risk. The American Heart Association issued a scientific statement warning that NSAIDs can raise blood pressure, promote sodium retention, and interfere with the protective lining of blood vessels called the endothelium. When that lining gets damaged, plaque builds faster. Clots form easier. And for someone whose arteries are already narrower than they were at 40, that's a recipe for disaster. Now think about how casually most people use these drugs. No prescription needed, no pharmacist consultation required. You buy them next to the toothpaste. And many seniors take them daily for chronic joint pain without ever connecting the dots between that pill and the tightness in their chest or the headaches that started 6 months ago. What can you do? First, talk to your doctor about whether acetaminophen, Tylenol, might manage your pain with less cardiovascular risk. It works differently. It doesn't thin the stomach lining or affect blood vessel function the same way. Second, explore topical alternatives. Diclofenac gel, for example, delivers anti-inflammatory relief directly to the joint without flooding your entire bloodstream. Third, consider non-drug approaches. Physical therapy, gentle stretching, warm compresses, even acupuncture. These won't spike your blood pressure. If you must use an NSAID, use the lowest effective dose for the shortest possible time. That's not my opinion. That's directly from FDA guidance updated specifically because of cardiovascular concerns in older adults. Number 2 might surprise you. Proton pump inhibitors, brand names like Prilosec, Nexium, Protonix. These are acid reflux medications and they are everywhere. Roughly 15 million Americans use prescription PPIs, and millions more buy them over the counter for heartburn and gastroesophageal reflux disease. When these drugs first came out, they were considered remarkably safe, and for short-term use, 2 to 8 weeks, they generally are. The problem is that short-term became long-term for an enormous number of seniors. You started taking omeprazole after a bad bout of acid reflux in your late 50s, your doctor never revisited it, and now you've been on it for 7 or 8 years straight. A 2015 study from Stanford University, published in the journal PLOS One, analyzed medical records of nearly 3 million patients and found that PPI use was associated with a 16 to 21% increased risk of heart attack, even in people with no prior history of cardiovascular disease. A separate study published in the British Medical Journal linked long-term PPI use with increased stroke risk. The proposed mechanism involves how PPIs affect nitric oxide production in blood vessel walls. Nitric oxide keeps your arteries relaxed and flexible. When production drops, vessels stiffen, blood pressure rises, and clot risk increases. Additionally, long-term PPI use has been linked to magnesium depletion. Magnesium is critical for heart rhythm regulation. Low magnesium can trigger arrhythmias, irregular heartbeats that themselves increase stroke risk. Many seniors ignore this connection because acid reflux feels immediate and uncomfortable, while cardiovascular damage accumulates silently over years. You feel the burn in your chest from reflux. You don't feel your arteries hardening. What should you do? Ask your doctor whether you still need the PPI. Many people can step down to an H2 blocker like famotidine, Pepcid, which works through a different mechanism and carries less cardiovascular concern. Elevating the head of your bed by 6 inches, eating smaller evening meals, avoiding food within 3 hours of lying down, and cutting back on coffee, alcohol, and spicy foods can reduce reflux naturally. Some people discover they can manage without medication entirely once lifestyle adjustments are in place. Number 3. Certain antibiotics. Now, nobody takes antibiotics every day, at least they shouldn't. But specific classes prescribed frequently to seniors carry documented cardiovascular risks that most patients are never warned about. Azithromycin. You might know it as a Z-Pak. It's one of the most commonly prescribed antibiotics in the country for bronchitis, sinus infections, and pneumonia. A study published in the New England Journal of Medicine in 2012 found that patients taking azithromycin had a 2.5 times greater risk of cardiovascular death compared to those taking no antibiotic, particularly during the first 5 days of treatment. The drug can prolong something called the QT interval on your heart's electrical cycle. When that interval stretches too long, it can trigger a fatal arrhythmia called torsades de pointes. Your heart essentially quivers instead of pumping. For seniors already on other medications that affect heart rhythm, antidepressants, certain blood pressure drugs, antipsychotics, adding azithromycin creates a compounding danger that many prescribers don't adequately screen for. Then there are fluoroquinolones, ciprofloxacin, levofloxacin. These carry FDA black box warnings, the most serious warning the agency issues, for aortic dissection and aortic aneurysm risk. The aorta is your body's largest artery. A dissection means its inner wall tears. In many cases, this is immediately fatal. A 2018 study in the British Medical Journal found fluoroquinolone users had a 66% higher risk of aortic aneurysm or dissection within 60 days of use. If you're over 60 and your doctor prescribes either of these antibiotics, ask one simple question. Is there an alternative that carries less cardiac risk for my age group? Often there is. Amoxicillin, doxycycline, or cephalosporins may treat the same infection without the cardiovascular baggage. Your doctor may have a perfectly good reason for choosing azithromycin or a fluoroquinolone, but you deserve to understand the trade-off. If you're over 60 or caring for an elderly loved one, this information could genuinely be life-saving. Please consider sharing this video with someone who might benefit. Sometimes one conversation about medication safety prevents a catastrophic event. Number 4. Decongestants, pseudoephedrine, that's Sudafed, and phenylephrine, found in dozens of cold and sinus products on pharmacy shelves. These feel like nothing. You have a stuffy nose, you grab a box, you breathe easier in 30 minutes. What could possibly go wrong? Plenty. If you're over 60, decongestants work by constricting blood vessels in your nasal passages. That's how they reduce swelling and open your airways. The problem is they don't only constrict nasal blood vessels. They constrict blood vessels throughout your entire body. Your blood pressure rises, your heart rate increases, your cardiac workload jumps. For a healthy 30-year-old, this is trivial. For a 68-year-old with mild hypertension, partially blocked coronary arteries, or a history of atrial fibrillation, this is playing with fire. The American Heart Association explicitly warns that people with high blood pressure, heart disease, or stroke history should avoid oral decongestants. Yet these products sit on open shelves with no age-gated warnings. Many seniors grab them during cold season without a second thought, sometimes stacking them with their regular blood pressure medications and unknowingly creating a dangerous tug-of-war inside their circulatory system. A case report published in the Journal of Emergency Medicine described a 72-year-old man who suffered a hypertensive crisis and subsequent stroke after 3 days of pseudoephedrine use for a sinus cold. He had controlled hypertension. His blood pressure was normally well managed. The decongestant overwhelmed his medication. Safer alternatives exist. Saline nasal sprays physically flush congestion without any systemic effect. Nasal corticosteroid sprays like fluticasone reduce inflammation locally. Steam inhalation, warm compresses across the sinuses, and staying well hydrated all help mucus drain without touching your blood pressure. If congestion is severe and you feel you need something stronger, call your doctor or pharmacist specifically and say, "I have high blood pressure. What decongestant is safe for me?" In many cases, the honest answer is none of the oral ones. Number 5. Certain antidepressants. This one requires sensitivity because depression in seniors is real, it's undertreated, and nobody should feel ashamed of needing medication for their mental health. But specific classes of antidepressants carry cardiovascular risks that warrant open conversation. Tricyclic antidepressants, amitriptyline, nortriptyline, desipramine, were among the earliest antidepressants developed. They're still prescribed today, sometimes for depression, sometimes for chronic pain or migraine prevention. TCAs affect the heart's electrical conduction system directly. They can prolong the QT interval, cause orthostatic hypotension, that sudden blood pressure drop when you stand up that makes you dizzy, and in overdose, they're cardiotoxic. Even at therapeutic doses in older adults with pre-existing conduction abnormalities, they pose measurable risk. A study in the British Medical Journal found that tricyclic antidepressant use in adults over 65 was associated with significantly higher rates of myocardial infarction compared to SSRI use. The risk was particularly elevated in the first month after starting or increasing the dose. Even within the SSRI class, generally considered safer, high doses of citalopram, Celexa, prompted the FDA to issue a 2011 safety warning. Doses above 20 milligrams in patients over 60 were found to cause dose-dependent QT prolongation. The maximum recommended dose for seniors was capped at 20 milligrams, specifically because of cardiac arrhythmia concerns. What does this mean for you? If you're on a tricyclic antidepressant and you're over 60, ask your doctor whether a newer agent, an SSRI at appropriate dose, or an SNRI like duloxetine might offer similar benefit with less cardiac risk. If you're on citalopram, confirm your dose hasn't crept above the recommended ceiling for your age group. And if you experience palpitations, dizziness upon standing, or fainting spells while on any antidepressant, report it immediately rather than assuming it's just aging. Depression treatment matters. But the right depression treatment matters more. Let's bring this all together. 5 extremely common medications. NSAIDs like ibuprofen and naproxen that stiffen your arteries and raise blood pressure over time. Proton pump inhibitors that impair nitric oxide and deplete magnesium with years of unchecked use. Certain antibiotics, azithromycin and fluoroquinolones, that disrupt heart rhythm or threaten your aorta. Oral decongestants that spike blood pressure in people who can least afford it. And specific antidepressants, tricyclics and high-dose citalopram that alter cardiac conduction. None of these are evil drugs. Every single one was developed to help people. The danger isn't in the pill itself. It's in the unexamined pill. The one nobody's revisited in 5 years. The one you started at 52 and never questioned at 71. The over-the-counter one you assumed was safe because it didn't require a prescription. Here's your action plan. First, schedule what's called a medication review with your doctor or pharmacist. Bring every single bottle, prescription and over-the-counter, and ask them to evaluate your cardiovascular risk profile against your current medication list. Second, never assume that over-the-counter means risk-free. It doesn't. Third, ask about alternatives whenever a new medication is prescribed. Say these exact words. Does this carry any heart or stroke risk for someone my age? Fourth, report new symptoms. Dizziness, palpitations, unusual fatigue, swelling in your ankles, chest tightness. These deserve investigation, not dismissal. You've spent your whole life taking care of other people, raising children, showing up for work, supporting your community. Now it's time to take care of yourself with the same dedication, and that starts with understanding what you're putting into your body and why. Knowledge isn't fear, knowledge is power, and today, you have more of it than you did 28 minutes ago. If this video helped you, I need you to do something for me. Hit that subscribe button so you never miss another senior health video. Share this with your spouse, your sibling, your neighbor, anyone over 60 who takes daily medication and hasn't questioned it in a while. Drop a comment below telling me which of these 5 surprised you the most. I read every single one, and your experience might help someone else watching. Take care of that heart. It's carried you this far, and with the right attention, it'll carry you so much further. I'll see you in the next one.